Well, intravenous sedation, the intravenous part is obviously placing a drug into the vein. So it has the benefit of knowing how much drug you're giving and how much is going to be active at any one time. If you give oral sedation, you give tablets, it's got to go through the stomach, it's got to be absorbed, and there's different people will absorb a drug at different rates. It will depend on whether they've eaten or how long ago they ate. And so it means that intravenous sedation is much more controlled. It's also much more legislated for, and we have to be very careful, we have to be qualified, and we have to do retraining every year for the care of sedated patients. It's brilliant because the principal drug we use is called midazolam, and it not only sedates, but it removes anxiety. So patients who are absolutely phobic of dentistry or any medical environment, once you get a cannula in and you've given them some drug, they are very, very easy to treat. They're relaxed, all their anxiety goes. It's almost like a miracle. They become completely normal, happy, easy to treat patients. We use a different amount of sedation for different patients, so it's very much, one patient might need 2 milligrams and somebody else might need 5 or 6. So we have to be very careful about what we're using. We have to know how to manage emergencies, people who might not have told you their entire medical history. One of the most important preparatory stages in treating anybody under sedation is taking an excellent medical history. And we need to know all the drugs they're on, we need to know all their past illnesses, operations, conditions, so that we can assess whether they're suitable for sedation in a dental practice. If they're healthy, then sedation is very, very straightforward. We give a certain amount of drug and we wait. We want to see how it affects them, and then we top it up as required to get them to the level of sedation that we want. It means that patients who otherwise could not accept any dental treatment can accept it willingly. It also means that patients who need extensive procedures, possibly something like wisdom tooth surgery, they might not have a health fund. They may not be able to afford to go to hospital and pay for day surgery, including an anaesthetist fee as well as the surgical fee. So these patients find that sedation is wonderful because there's no hospital fee and the sedation fee is relatively small, and therefore by the time they've had their wisdom teeth out under sedation, they could save themselves a considerable amount of money. So sedation has benefits both in terms of control of anxiety and also allowing patients to have procedures provided in a practice environment rather than a hospital environment, which can be financially more acceptable for them.